if something happens to that gentleman, he's in his late 70s, it's very likely he could land in the hospital for an extended period of time. It could bankrupt him. About 2/3 of bankruptcies are medical bankruptcies. And it's completely avoidable. All you need is the information. Enroll in one of these Advantage plans, and you've got some protection there. Even if you don't like how they work, none of these are perfect, I'll tell you that. There's no perfect solutions in there, but it's a good solution. It's something that will protect you. You just need to take the right steps to do it. And it's not hard to do. So they're going to get their money through out-of-pocket costs, deductibles, copayments, and coinsurance. They're going to get their money on the back end whenever you're using the services. If I have an earache, I'm on an Advantage plan. My wife says, I'm not on an Advantage plan, but let's say I was. My wife says, you need to go to the doctor and get your ear checked out. Okay, it's not going to cost me anything to see my primary care physician, or it might cost me $20. So I go see my primary care physician. And the doctor looks at my ear and says, I don't see anything, but I'm going to go ahead and send you to this specialist over here and this specialist over here and let them check things out. So I go see the specialist. That costs me a little bit more. So their copays are higher, maybe $30, $35. And this specialist over here says, I'm looking at that. I don't see anything. But, sometimes an earache could be a sign of a tumor. Maybe I'd like to order some imaging. Let's do an MRI and take a look at it. Okay. I've got a procedure going on now. Guess what? That procedure's got a copay. And this doctor over here takes a look at me, says, I don't see anything, but it could be a sign of an infection. Bacterial infections are pretty easy to detect. Viral infections are a little bit harder. Let's do some blood labs. So now I've got another procedure going on. Guess what? That's got a copay. Every time that the carousel goes around, they're collecting a copay from me over here. Now my little earache that I thought was going to be $20 is costing me hundreds of dollars. And then I've got to go back and somebody's got to interpret all of that stuff and then prescribe me some meds, and we got to figure out what we're going to do with it. But one of the big deals about this is prior authorization. And that means that the insurance company gets to decide what procedures that they're going to pay for. Over here with a Medigap plan, your health care is between you and your doctor. Over here, it's between you and your doctor and your insurance company. And for me, that's a deal breaker. Now, some people, they're totally okay with that. And if so, that's fine. There's many, many people do this. In fact, about half of the people in the world or in America that have these plans do Advantage plans. And about half of the people say, I want a Medigap plan. I just want you to know what your options are over here. So what does Part A and Part B not cover? It doesn't cover prescription drugs. It doesn't cover dental, vision, and hearing. That's routine dental, vision, and hearing. There are certain dental, vision, and hearing procedures that are covered, like cataract surgery gets covered. But routine dental, vision, and hearing is not covered. Doesn't cover long-term and custodial care. So if you're counting on Medicare to be there for you when you need a nursing home, it's not going to be there. What is custodial care? Custodial care is activities of daily living. So things we all have to do, like we have to get dressed, we have to bathe, we have to eat, things like that. Medicare doesn't help you with that kind of stuff. Now, if you need home health care, it does help with that sort of thing. And that's good. If a nurse comes to your home and gives you meds, administers meds, changes your bandages, and goes then leaves, Medicare will help you with that. But there is such a thing as home care, where somebody who looks like a nurse comes to your home and helps you with stuff like getting around and bathing and changing clothes and stuff like that. Medicare doesn't pay for that. That's a completely different thing. And if you think that that's something you're going to be contending with at some point, we need to have that conversation. There's other solutions for that, and I can help you with that. It's not a Medicare thing, though. Yeah, so I'm not familiar with California, but perhaps it could have something to do with their state program. And it's a good thing that you bring that up, because in Texas, we have Medicaid. Sounds a lot like Medicare. It's a state program. Medicare is a federal program, and this is for people who are older or have certain medical conditions. Medicaid is designed for people who have very limited resources. And so they're two separate programs. I don't really deal with Medicaid, but they sometimes work together. Let's talk about late enrollment penalties. Part B has a late enrollment penalty. It's 10% per year for every year that you could have been on Part B, that you were not on Part B when you decide to get on Part B later. I'll tell you how this comes up most often. It's usually with veterans. Yes, a guy served in the military, gets to be 65, and he says, I don't want to pay $174.70 a month. I have VA benefits. I'm 65. I feel good. I hardly ever go to the doctor anyway. And why would I want to pay $175 a month? And they just blow it off. They're just like, Medicare doesn't even happen. And let's just say about 3 years down the road, they're complaining to one of their buddies about the VA. It's very common. And their buddy says, well, why don't you get on the Medicare? Because I didn't want to pay $174.70 a month. Well, you don't like what you're doing now, so why don't you go ahead and get on the Medicare? Well, I get the call. I'd like to get on Medicare. Great. It's $174.70 a month, plus 3 years times 10% for all the years that you were not on there that you could have been on there. And guess what? That penalty is for life. Yes, it is not a one-time penalty. And if you think about it, all these numbers go up over time. So what's $174.70 today might be $200 next year. It might be more than that the year after. That 10% penalty is going to escalate right along with that premium. So if you think you might want to postpone that, remember, veteran benefits are not creditable. COBRA is not creditable. Medigap plans, different story. Medigap plans are subject to what they call medical underwriting, which means that they get to ask you questions about your medical history, and they will check on it. They have what they call a medical information bureau. It's kind of like a credit report, except they check on your health report and on what prescriptions that you have. And they're very good at tracking those things down. And so they're going to check and see, you got anything that we might want to disqualify this person over. So one way to get onto a Medigap plan, the best way to get onto a Medigap plan, is when you first enroll in Medicare Part B, because you get a 6-month open enrollment period when you first enroll in Part B. Now remember, I said when you enroll in Part B, not when you turn 65. It's when you enroll in Part B. That's when the clock starts. You can get onto any Medigap plan that you want to, no questions asked. Now, after that, if you want to get onto a Medigap plan, you're going to have to answer medical questions. You're going to have to pass medical underwriting. And I get people sometimes that say, I'd really like to get on the Advantage plan because it's 0 premium and I get all of these extra benefits over here, and I'd like to ride that horse as far as I can. And then when I get sick, then I'll come over here and go onto the Medigap plan. Then we go into the Advantage plan over here. And then they want to move back to Medigap. Well, it doesn't work because at that point you're sick and you can't get over here.